Live from the Business RadioX studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
Hello, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and folks, we are in for a great show today. Stephen Deason is with us. Stephen is with the OPA Health Group, and we are excited to have him here. We're going to get to him in a moment, but I just want to remind you that if you are tired of the mega bank experience, if you're at one of those big banks, they don't really want to talk to you live. They want a recorded voice to talk to you. And if you're tired of that, if you think your business deserves a little bit better in terms of your banking experience, then I get it. And here's what I know is that the folks I've referred to Renaissance Bank tell me that Renaissance is big enough to handle pretty much any need you can throw at them, but they're small enough to deliver those services in a personal way. That's what I've heard from those folks, and I think you'll find the same thing. Go to renaissancebank.com and find one of their local offices and be in touch. I think you'll be glad you did. Renaissance Bank, understanding you, member FDIC. Again, I want to welcome Stephen Deason. Stephen is with the OPA Health Group. Stephen, welcome.
Thank you for having me on today, John.
Yeah, great to have you. Let's talk about you and the OPA Health Group. How are you serving folks out there?
For about 6 years now, since 2019, we've been doing OPA medical staffing, which is providing CNAs, med techs, LPNs, RNs, all kinds of nursing and allied health professionals. We're across 15 states now, and we're really proud of progress in that particular area. We've recently ventured into home care, providing PCAs and other types of home health aides to folks in the Atlanta metropolitan area. We've been doing that for about 1.5 years now. We've done around 7,000 or so shifts that we've been able to fill and really take care of a lot of folks here in the Atlanta metropolitan area who have been in need.
That sounds like great work, and I want to hear more about that, Stephen. But before we do that, let's talk a little bit about your backstory. Why home health care? Home healthcare staffing, or healthcare staffing, I should say. Why that business for you? Why are you passionate about that work?
John, there's a couple of reasons. The first one is I worked my way through college as an orderly in hospitals, was what they called men back then. We couldn't be CNAs. We couldn't be nursing assistants because we were male, which tells you about how old I am. But the other reason is because I'm a person in long-term recovery from drug and alcohol addiction, and that's a big part of my life. I serve on a lot of nonprofit boards and do a lot of work in that community in the area. And so my life is really about service. And the question became one of, how do I provide service on a day-to-day basis in a way that's really meaningful and impactful to humanity and to people who are in need?
That's a fantastic story, for sure. So let's get into that and how you do that on a day-to-day basis. Let's talk a little bit about, I guess, the evolution of the business maybe is the way to put it. You started with staffing.
Yep.
Back in 2019, you said.
We did.
Yeah. So why staffing? Why is there such a need for that particular business or the services of that business? And then why did you go from staffing and branch off into home health care?
That's a little bit of an interesting story. If we go back to 2016, 2017, and I want to give a shout out to a gentleman named Greg Block, and there's a Greg Block Day here in Atlanta, Georgia. Greg founded a company called First Step Staffing, and its focal point is to help homeless people. And Greg has since passed. Amelia Nickerson runs that company now, and Amelia is just a wonderful person. Greg began mentoring me. And one of the things that Greg asked me to do was, he said, if you want to have impact at scale, people are always looking for people. And so our internal mantra is because, people, period. We are in the business we're in because finding good people is very difficult. And one of the things we wanted to do was find a way to help businesses and at the same time help folks find jobs. Where that led us, given some of my background, and I didn't just start off as an orderly in a hospital. I furthered my footprint in medicine by building some pretty interesting systems over the years, and understood a lot of the medical lingo and the upside down market. There's just so much demand for healthcare resources, human resources in the United States, that we said, if we're going to build a staffing agency, let's do it around medicine. And so that's where we started, and we unfortunately walked right into COVID, which a lot of people say, that was good or was it bad? And the answer was, it was both. Like most things, it was a dialectic.
That's true. Yeah, I'm laughing, but it's true.
It was a really painful time for kind of everybody. And certainly my heart goes out to all the healthcare workers out there who did such yeoman's labor during that time period to work in everything from the skilled nursing facilities all the way to the hospitals, the acute care hospitals. We did a pretty good job during that time of landing an awful lot of clients. We started to expand that business in a very positive way. I think we have a pretty solid reputation in that market. We've retained a lot of our clients are still with us after 5-6 years. One of the things that happened though was that market began to dry up. People wanted to start pulling their recruiting in-house. And so we started looking around and saying, we've got a lot of workers, some of them really good. And what are the other businesses where we can go help people using this staff that we've already built? And I've got a friend, Hamid Manjali, out in San Antonio, Texas, who owns a medical staffing business and a home care agency. And he started in home care, and he started telling me, Stephen, you need to go into home care. Now, I'm a big believer that God speaks to us through other people. And I'm a real stubborn person. I don't necessarily like to listen all that well, but eventually if you thump me, eventually if God thumps me in the head enough, I start to pay attention.
Okay.
You know? So we moved into home care and really evaluated it for about 6 months as a business model, and then said, yeah, let's go ahead and do this. Hired some really good consultants to get us going so that we made sure we were on the right path with everything, people well experienced in the industry. That's what we've done.
Wow, that's a great story. So I would imagine that those businesses have a similar back office, you might say, for lack of a better term, structure to them behind the scenes that helps make them complementary beyond the reasons you explained.
100%. We're able to run, our staffing in many states is required to run payroll weekly. So we run payroll weekly, have drawdown accounts so that our workers, who often are not the highest paid people in the world, so that they can pull money out of their accounts the day after their shift. We were able to leverage all of those things, our HR, our recruiting capabilities, all that fun stuff. So it really did make it a lot easier than somebody standing one of these things up from the ground up.
Yeah. You talked about the higher purpose you have for this business. So I would imagine that the name of the business has some meaning. OPA.
OPA is the Greek word for celebrate life. And it actually comes out of a Fast Company article I was reading about, 17, 18 years ago. And I thought, the next time I start a human-centered business, I want it to incorporate some of that philosophy in it. So it stands for others, purpose, and attitude, but it's also that Greek word that stands for celebrate life, and it has a dual meaning. It also means watch out for the things that trip you up. I just thought was the perfect name for an organization that was really mission-centered and mission-focused.
That's wonderful. It has a much deeper meaning than just, here's your cheese that's on fire.
Or there's the plate you broke. Exactly. Right. 100%.
I love it. I love it. Let's talk about the issues that your staffing clients have when it comes to, I guess, we know about the talent shortage. Just talk about how that is happening in healthcare in particular, because I would imagine through the pandemic and after the pandemic and just the disruption all that caused that entire industry, staffing is a particular issue.
I think it goes beyond that, and I agree with you there. It certainly has disrupted the way that the labor market worked in that space. And in addition to that, we have a generational change that's happening, right? The baby boomers, the eldest of them reached 79, 80 years old this year. The youngest of them, therefore, are about 60. A lot of the nurses, a lot of the CNAs, a lot of the people who provide direct patient care they're just getting older. They're not able to work 60, 70 hours a week anymore. And hospitals and nursing homes have often relied on those people to provide those services. The other challenge that you have is that we just, quite frankly, have a lot more, whether it's flu season, COVID season, et cetera, we just have a lot more diseases that flow through things. And we're human. We're all fragile. We're susceptible to getting sick, to having family members get ill, et cetera, right? And a nursing home, for instance, never knows whether somebody's going to come in and need to take off a week or 2 or 5 or whatever goes on there. And we just want to be that company that's there to provide PRN or as needed help when they run into a situation that's difficult for them to deal with. One of the most interesting things, John, if you don't mind me diverging, that we had happen recently is somebody called us and they said, listen, we don't need any medical care, but all of our food service workers have to be FBI background fingerprint checked in Georgia now. And we don't know any staffing agency that can help us with that, but you guys know how to do that. Can you find us food service workers? And so we went, yeah, if that's what you need, let's see if we can do it. So we did that, and we made sure all of the elderly people in their facility get fed 3 times a day, which is important.
That would be healthcare, right?
Absolutely.
Yeah.
It's important that we get you fed and that we get you changed and washed and cleaned up. Yeah.
Right. Absolutely. So what makes how does the dynamics of that industry work? Do your clients work with multiple providers for staffing to hedge their bets, or do they see, hey, OPA's doing a great job for us and they center on you? How does that work?
We don't have any clients that we're the sole provider for, and we don't encourage that. Even if we had that opportunity, you need a few backups because the labor pool's large and your need is going to be pretty immediate when it comes. So we encourage our clients, like, you need to work with 2 or 3 good agencies that'll answer the phone and take care of your needs.
You're in 15 states.
Yep.
Talk about the challenges of being multi-jurisdictional, shall we say.
The filing is a headache, if I have to say that. Keeping up with all the labor law changes. Of course, without going too deep into that, we're in a politically charged environment. So there are a lot of changes that are happening on a very frequent basis, both at the federal and at the state level. We try to stay on top of. We have great labor attorneys that help us with that. Certainly, there's been a lot of noise in the market over the last few years about licensure for staffing agencies, in particular medical staffing agencies, and those licensure requirements are changing on a weekly or monthly basis right now.
And even within a state, right? It's not just at the state level.
Yeah, within a state, sometimes within the local business jurisdictions, the cities promulgating their own laws and regulations. It can be different between a nursing home that's 3 miles away from a hospital.
Yeah.
And fortunately, we are Joint Commission accredited on that side of our house, so they help keep us in line.
So you started the home care business, what year again? The in-home healthcare.
Late 2023.
Okay, late 2023. So you've been in that business now for coming up on 2 years, as it were. Talk about, is that just here in the metro Atlanta area, North Fulton at this point, or have you moved beyond already?
No, we're really in the Atlanta MSA, the Metropolitan Statistical Region. The reason for that is that home care agency licensure in the state of Georgia is a PHCP. It's a private home care provider license, and it's licensed by county, by the Department of Community Health.
That sounds onerous as well.
It's not. Working with the DCH has actually been really smooth. They're very customer service oriented over there, and I really appreciate that about them.
Excellent. Okay, that's good to hear. I'm glad we could report. That's not always the case with government agencies, so that's good that we can report that here in Georgia. Talk about, I guess, the issues that you see in home health care and what makes you stand out versus other agencies that are out there.
I think of 3 things that really make us stand out. The first one is that we have this staffing background. So we really understand the provider market in this space, maybe at a level most other home care agencies do not. My internal team is just exceptional at making sure shifts are backfilled. We just had one of those happen this morning. I call it a high-speed Tetris match every day. So we're moving people around and juggling things so that everybody gets the care they deserve. So far, we are, just as a point of proof on that, we have filled just north of 7,000 shifts. We haven't missed any.
Oh, wow.
Now, that doesn't mean we haven't been late for a few. We have been, but we have yet to miss a shift, and that is almost unheard of in our space.
Let's talk about why that is for a second, because I'm not sure that the average consumer of those services gets that.
Okay.
Because you're dealing with folks that want this job for flexibility reasons. They've got a lot going on in their lives, and there's a lot of reasons why they would want a job like this, but they just got a lot of differences in terms of their life that causes them issues, right?
They sure do.
Yeah.
Some people do this as a profession, but many of them are students. An exam will show up at the last minute they need to make. The lady this morning called out because her child got a fever and she had to take him to the hospital. And
she doesn't have child care maybe or something like that. So
child care, no family in the local area. You're exactly right. So she's got to make a decision between taking care of the person she committed to taking care of and taking her kid to the hospital. And so we have our internal team. I think that's our second differentiator, if you don't mind me.
Yeah, please.
Yeah. So our senior recruiter I like to joke with people. I say, we got her from prison. People always look at me a little strange when I do that. I'm like, she worked for the Federal Bureau of Prisons as a therapist for many years. So she has a really good eye for when people are stable or when something's a little bit off. I'd say about 1 out of 4 people that make it into our office make it into the interview process with her. She's pretty tough. And she's just got a good BS detector, if there's such a thing. Our clinical director is a foreign-trained MD with a specialty in emergency and family medicine, and he does our assessments. He's really great at spotting things that other agencies may not see, levels of care that need to be taken that we might not otherwise see. And then our administrator and our chief nursing officer is a former director of nursing for 3 different nursing homes. I know her from our staffing side, and she's just absolutely amazing and sharp and makes sure that we stay in tight compliance with the state regulations and things.
I guess where I'm going with these questions is it seems to me that your business is very much the proverbial cliche of the duck on top of the water that seems placid, but underneath is scrambling, right? And that maybe those of us that aren't in this business, and certainly your clients who use your services, don't fully appreciate that.
Yeah, I think that's a really great point. We work really hard so that our clients don't feel any of the disruption that we often see inside the office, the caregiver base, with the background checks, with the audits from the state and so forth. Like none of that's not really something that should impact them. Their concern, as it should be, is their elderly mom, their child who's suffering from cerebral palsy. That's their focus, and that should remain their focus. And we do our best to keep all of the rest of the messy stuff away from them.
So let's talk to those folks they need someone to come in and care for mom. Mom suddenly needs this.
Yep.
And they don't know where to go, who to choose. Give them advice on what they need to be looking for, what questions they need to ask to make sure they make the right decision.
Yeah, the first question I would ask is, how many times in the last month have you guys had to call a client and let them know that you're not going to be able to provide services that day? The second question I would ask is, are you licensed by the state? Can I see a copy of that, your bonding, your insurance, and so forth? The third thing that I would look for, because again, you're trusting someone with your loved one, whether it's a disabled child all the way through an adult that needs care, is what's the expectation in terms of how you put that on your internal staff, your field staff, right? And then does the company itself run a good business? Is the business a good business? A lot of people get lost in the idea of we're a caring business. That's great right up to the point that you care so much about the caregiver that you give up on taking care of my mom. And then I'm really frustrated.
Yeah.
So is the business operating in a professional, ethical manner to make sure that everything, payroll's being taken care of on a timely basis? Hugely important for these guys, because as you mentioned, a lot of the care staff, they're living paycheck to paycheck, even when it's week to week,
Right.
much less when it's every 2 weeks.
Sure. And I can see how people would think, oh, I need to ask for a copy of their license. Isn't that a little rude? But you fully expect and encourage those kind of questions from potential clients.
Every time.
Yeah.
We have a book we take out with us when we go do site visits and do assessments that actually has all those documents in it. We show them to the client on site. We encourage them to take a picture of it. It's really important that you're going to leave an elderly, perhaps disabled person alone with someone for extended periods of time. The company that's doing so had better be trustworthy, is the way that I think about it.
Stephen Deason is with us, folks. He is with the OPA Health Group, a premier staffing company in the healthcare space and also home healthcare agency. Stephen, let's talk about client fits and make sure that we're clear on the types of clients on both sides of your businesses, the folks that need to be in touch with you.
So I said there were three things that differentiate our agency. One of them that I think is also very important is we'll do as short as a 2-hour shift once a month. A lot of agencies require a minimum of 24 hours a week. So we will do very short-term needs. The key there is that we have to be able to provide the services offered. So we look at things called ADLs, which are the activities of daily living, bathing, toileting, and so forth, like walking, mobility. We have an amazing partner network. I'll just give a shout out to some of those folks I know have been on your show and have had an amazing experience, John.
Thank you.
The critical thing is that we're probably best suited so we're pure private pay. We don't take any insurance at all. We don't take Medicare or Medicaid. So you do have to have some financial resources to be able to use our services, and we provide an exceptional level of care for that. So we look for folks, generally speaking, that are in their, I'd say, late 60s to a couple of clients that are in their hundreds, where maybe there's been a fall, there's some concern about mom or dad by the children about how they're able to take care of themselves. And sometimes we're able to provide community resources that are great for folks, but oftentimes we're saying, let's come over and we'll take a look at things and see if we can be of assistance in making sure that mom or dad are receiving the best care possible. Usually the family is looking at that option to keep the person in their home compared to, do I spend $7,000 a month to put them in kind of a first class assisted living facility? That's the comparison we're in.
Got it. I think it would be great at this point as we wrap things up if you could share a success story or two that help illustrate the great work you do.
Two of them I love to share is both my mother and my father-in-law are both clients. Without sharing too much HIPAA compliant information, which I can't do on the open
even
air.
With mom.
Not even with
especially
mom.
With mom, maybe.
Certainly, especially with mom, right? We have clients that range from people who are in facilities all the way to folks that we've provided 24-hour, 7-day a week, 365-day a year care to. And so I think, and we walk into some really complex situations, but we recently, and I can talk a little bit about people who have transitioned. We were recently recognized in somebody's obituary as what an amazing job helping this person through the last 2 or 3 months of their life.
Wow.
And then we got 2 letters very shortly thereafter from different clients saying, thank you so much for being there for my mother or my father in the last little bit. We really pride ourselves on some difficult but necessary moments and being present for people.
Yeah, wow. That's fantastic. Stephen, I think we need to send people directions on where they can find you. So let's give them coordinates on how they can learn more about you and your services.
I would love it if you just pick up the phone and call us. Our office line number is 404-689-5400. 689-4440. Again, that's 404-689-4440. Or you can look us up online at www.opahomecare.com.
Stephen Deason, the OPA Healthcare Group. Stephen, this has been fantastic. Congratulations on the work you do. Thank you for that work, and I'm delighted we could shine a light on it.
Thank you so much for having me on today, John. It's been an amazing journey.
Thank you.
Take care.
Hey, folks, a couple of quick things before we let you go for today. If you need some assistance, yes, that was pun intended. If you are a solo, small professional services firm and you need some assistance in understanding maybe the client perceived value that you provide, and that's different than the value you think, and that's a good thing. And I explain why in The Generosity Mindset, a journey to business success by raising your confidence, value, and prices. Yes, it's a book that I recently authored and published, and you can find out more about that book at thegenerositymindset.com. And I appreciate in advance your interest on that. I also want to thank you if you are listening to this show, because you are supporting our work to be the voice of business in the North Fulton region and beyond, and to feature great business leaders like Stephen and the other 1,200 or so that we've had on this show over the past almost 9 years. You continue to share the show and send us guests, and we couldn't do it without you. So thank you for your support of North Fulton Business Radio. We appreciate you. For my guest, Stephen Deason, I'm John Ray. Join us next time here on North Fulton Business Radio.